Okay, you're good to go.
All right. Hi, everybody, and welcome. I know we've been bombarded by talks and information on self-care and getting through crisis. I hope this one will be a little different and that everyone will come away with some new information about how we can not only survive, but grow and thrive as individuals and as an organization. I'll be asking questions along the way, and I encourage you to chat via text, offering your comments, and we'll have some time for QA at the end. As I was researching the topic, I came across an interesting word, perturbations. The word perturbations means anxiety or mental uneasiness, or a cause of anxiety or uneasiness. It also means a deviation of a system from its regular or normal path crossed by an outside influence. COVID has caused storms of perturbations. Consider all the ways it causes uneasiness and throws us off our paths. Ourselves, our friends, our families, our clients, and our company. How are we weathering the perturbations? That comes down to resilience. Resilience is defined as the capacity to recover quickly from difficulties. It can also refer to possessing a set of adaptive characteristics that enable an individual or organization to cope with and recover from or even thrive after stress or trauma. I'm a visual person. I try to picture resilience. How do you picture resilience? For me, my father showed up. I don't bring it up much, but both my parents are Holocaust survivors. My father survived concentration camp. He's now 91 and philosophizes about the current risks. I can't think of a better representation of resilience. Here's a list of traits I believe helped him and others survive. And the last four on the list, he added himself. Endures, maintains hope, keeps on going no matter what, routines one foot in front of the other, keep marching forward, does whatever is necessary, adapts, a positive outlook, family, secure relationships, trusting each other, interconnectedness, and being serious and yet playful. After we ran these by my father, he added a few of his own that we really hadn't thought about, my brother and I. He's also a therapist. Self-acceptance. He said that self-acceptance was an important part of surviving. He also described a certain type of pride in surviving. That was, I was a little surprised to hear that. He described taking pride in surviving. And I think that's part of motivated him to keep moving forward. Also, he talked about something called a bonus life. He described a bonus life, that he felt that what he did by surviving was he earned or he gave himself, somehow he was given a bonus life, and gratitude for that. And then he also added something I hadn't thought about, which is not being in a victim story, not being stuck as a survivor, as a victim. And he says all of those things were really things that helped him to survive. Meaning is a critical aspect of resilience. Growing up as a child of survivors, I became interested in the book Man's Search for Meaning by Viktor Frankl. In it, he writes about how he survived concentration camps and a death march. There's a transcendence that goes beyond current events, towards the future, a sense of what is right, and it adds significance to the suffering, which encourages pushing forward. Are you able to connect with any meanings for the suffering due to the pandemic? Examples might be coming together, bringing out our best, or a wake-up call. We can also examine our narratives. It's healthy to be able to describe our life autobiographically, as a series of chapters. We all have our own life narrative. What was your story, and how does the situation modify that? Here's a list of similar psychosocial factors that are shown to be contributing to resilience in individuals. And there's also individual neurobiological factors, such as genetic and epigenetic neurochemical systems and neural networks. We now know that genes can be turned on and off by, say, trauma, and that's the epigenetics, is the expression of the genes that were given. And then the neurochemical systems we know can be influenced by medications, and diet, nutrition, and supplements. And the neural networks can be affected by meditation and other factors as well. Now, switching over to team resilience. Team resilience is defined as the capacity to bounce back from failures, setbacks, conflicts, or any other threat to well-being. As on a team level, it's more of a dynamic psychosocial process which protects a group of individuals from the potential negative effect of stressors they collectively encounter. It comprises processes and systems whereby team members use their individual and collective resources to positively adapt when experiencing adversity. One perspective for organizational resilience is to look at these four dimensions: mastery approaches, social capital, collective efficacy, and group structure. How we approach adversities, mastering our approaches to adversities. These represent the team members' shared attitudes and behaviors that promote team learning and improvement. In mastery approaches, we focus on learning and improvement as a group during setbacks. There's intense preparation to face stressors and also learning from challenging situations. Social capital reflects our social networks, social norms, and trustful relationships that enable team members to work together in pursuing shared goals. This is related to perceived social support among the team members, deep bonds between some team members, and also very important, a no-blame culture when experiencing failures. Collective efficacy represents team shared belief that members are able to organize and carry out the activities required for the organization to be effective and successful, such as remaining together during the crisis, gaining confidence from the actions of other team members. Group structure provides the structure that defines the relationships between the team members, and that includes the shared vision, open and honest communication, and shared leadership. Close the door here. Get rid of the airplane. This all leads back to interdependence and interconnectedness. And we as individuals are interconnected and interdependent on each other, as well as on the company and on our members. We all need each other. Allinger in 2015 outlined 3 behavioral strategies to underpin a team's capacity to deal with pressure, stressors, or difficult situations. Minimizing actions were proactive in nature. That has to do with preempting challenges, contingency planning, and continual self-assessment of readiness. Also, managing actions were described as reflexive, strategies to assess and address stressors within real time. And then mending strategies were reflective, to adapt and facilitate recovery, and then to build for the future. He also outlined 5 markers of team resilience. Challenge resolution, which has to do with addressing problems quickly and effectively. Health, to maintain function in a way that facilitates team spirit and mood. Resources, maintaining social, emotional resources during challenge resolution. Recovery, ability to bounce back to previous levels. Ongoing viability, maintain the ability to meet future challenges optimally. Lawrence and Maitlis in 2012 described 3 sets of beliefs engendered within caring narrative practices to underpin the development of team resilience capacity. Go back here. Potency, or a collective belief arising from positive past experiences, facilitate development through reinforcing team goals and increasing team persistence. Contextualizing people's struggles fostered a sense of agency and enhanced team responses to problems. And a transcendent hope maximized team resilience through energizing the team members and providing the belief of positive future experiences. This is one scale that I found that looks at measuring resilience for an organization, and we can get more information on that in the future if we're interested. I'm going to shift gears at this point. Much of the rest of the presentation will focus on self-care. To start with, how many of you have heard of telomeres? Telomeres are at the end of DNA strands. They're like the end of the shoelaces that keeps the shoelaces from getting frizzy. And we know that when the telomeres, or the little plastic at the end of the shoelaces, when that's gone, the shoelace starts to frazzle and unwind, and it becomes more and more useless. And it's sort of a similar process with our telomeres. They shorten as we age. And telomerase is an enzyme that helps telomeres grow. We can now identify chemicals and behaviors that can make telomeres shorten faster and speed aging, or telomeres shorten slower and slow aging. In 1984, telomerase was discovered, and it's an enzyme that causes telomeres to grow. Research since then has shown what factors speed up or slow down aging. The book, The Immortality Edge, describes positive and negative factors and scores them. And in that book, you can actually take a test and find out your telomere age. Check out this list of lifestyle factors that have been shown to shorten life. These are things that will shorten your telomeres more quickly. Even interesting things like dropping out of high school and low income affects your telomere age. And these are factors that are shown to lengthen life. Having close friends you can talk to, having a hobby, higher income, being a college or postgraduate graduate, seeing your primary care doctor regularly, happiness, all of these things, meditation, have been shown to lengthen your life. Here's one example of one factor, is just the question of breakfast. Skipping breakfast versus having a nutritious breakfast. I took this test myself, and basically you can sort of identify your telomere age based on your habits and routines. And skipping breakfast, you lose a lot of points. Having some kind of a crappy breakfast, you get some points. But having a nutritious breakfast, it's like blossoms, you get a lot of points for that. But you can really see from one end of the spectrum, poor habits, the other end of the spectrum, sort of ideal habits, and how this can really affect the telomere aging. We'll have to leave more of an extensive discussion about nutrition to Carrie, but suffice it to say that healthy eating is important. There's also increasing evidence in the integrative medicine world that happiness and positive affect can affect health. And we can, just a few more points here about oxidation, inflammation, glycation, and methylation. And most of this is related to diet. And we'll, again, leave most of that to Carrie. But going forward here, we can now image happiness. Okay, and we know that the happier you are, the longer you're going to live. Now it's tied in, and we can also see why. We can see that positive affect, positive emotions will reduce the risk of cardiovascular problems. Also, that connecting to people is good for the heart and the cardiovascular system. So social connectedness and positive mood support the cardiovascular system. Pessimism makes you die earlier and harms your immune system. Optimism mitigates stress. Happiness influences inflammation, reduces inflammation. And positive affect also helps balance cortisol and norepinephrine, which are stress chemicals. We can't talk about resilience without talking about wellness, self-care, and behavior change. So here we go. First of all, what is wellness? Well, it's just not sick and not depressed, normal blood sugar. Well, I look at that basically as illness until we get to wellness behaviors. And this is health. We say, what is wellness? Not being sick, not being depressed, having a normal blood pressure, being happy, that's health, but not necessarily wellness. Wellness is what we're going to talk about with additional routines, and that can make us well, that can optimize us and help us live longer. So we're going to talk about the difference between illness and health and wellness. A wellness approach is to start from wherever we are. Whether you have illness, whether you're just healthy but not well, We want to start from wherever we are and assessing our strengths and weaknesses and looking at what behaviors and priorities we may need to change. Behavior change requires being coachable, willing to let go of routines that don't work for us. Integrative is, there's, in case you're not aware, the difference between integrative medicine and functional medicine. Functional medicine is a little bit more narrowly focused, and integrative is a little bit more broad in terms of looking at biological, psychological, social, and spiritual behaviors as well. We should all have a wellness team, from a primary care doctor to perhaps a partner to a therapist, exercise coach, nutritionist, clergy, meditation teachers. We want to develop our own wellness team. Integrative also means integrating the responsibility for change. What's the role of the team versus what's your role? Only we can change our own behaviors. And we want to set wellness goals, and that includes integrating these goals into our everyday life. We're all at different starting points, like I said before, that we can be well, we can be ill, or we can just be healthy, and somewhere in between. And everyone, all of us, have biological and psychological and social and spiritual strengths and weaknesses. So here's an example of a physical spectrum of illness, health, and wellness, and the emotional spectrum of illness, health, and wellness. Just because somebody doesn't feel depressed or anxious doesn't mean they're well. We really want to look at the behaviors, and we can see that someone can be doing okay when there's no perturbations in their life. But perhaps some perturbations come along and blow us off track. And the more well we are, the more resilient we will be. And so that means preparing our bodies, preparing our soul, our spirit, our brains to be able to function during these stormy periods. So I work a lot on what are the obstacles to wellness, and we don't talk about removing these obstacles by talking about the past and why people do or don't do what they do. We really want to focus, I think, more on the behavior change. And I was talking with somebody earlier today. She's a nurse. She works on a COVID unit, and she keeps telling herself, "I'm not doing enough. I'm not doing enough. I'm not doing enough." And we talked about how she doesn't believe that she deserves to take care of herself. And so then she says, "Well, why do I believe that?" And we talked about, well, it doesn't matter why, because we can talk about why you believe that for years and nothing will change. So we want to learn how to work around these beliefs and just focus on what needs to be done to change. And so a lot of times that worthiness issue, how people are judging themselves, get in the way. We're going to talk a little bit more about stress, because stress is a major part of illness and also can get in the way of wellness. Stress shortens your life. Stress will shorten your life. And so many people I talk to think that stress and anxiety is a necessary part of life. And that's just not true. Even with illness, pressures, COVID, bad things happening, most of the bad things we obsess about don't happen. And when they do, we get through them. Most of the feelings about stress come from worrying about how others will judge us. Fears of failure, humiliation, and those worries usually go away when we're taking good care of ourselves. Um, I do want to recommend that you guys another time take a look at my video. It's online, called Body States, and it's about 7 minutes, and it shows what happens in our body under different states of what happens in our body under anxiety, what happens when we're angry, when we're scared, when we're calm, when we meditate. And so I do want to recommend you guys, when you have a chance, to Google the Body States video. I'm not going to show that today. You just Google Body States, Dr. Gilbert. Um, Stress is healthy. Fight or flight is healthy in short bursts when we face a real danger, but it's unhealthy when it goes on continuously. And stress is kind of our fight or flight system stuck in neutral. And we worry, we obsess round and round. but feel threatened by loss or embarrassment. And we want to ask ourselves how much of this obsessing is helpful. And usually, if we pause to ask, if we're mindful and aware enough to say, I'm obsessing right now, or I'm worrying, is this useful right now? Am I obsessing? Is this obsessing? Is it useful? Usually, if we ask the question, we can identify that it's usually not, or if sometimes it is. And we can choose what occupies our mind. That's a big part of meditation practice. So this is my image of stress. It's just a conveyor belt of one thing after another, after another, after another. And you just got to keep it moving. And there are always things that we can worry about. And the majority of the stressing is unproductive. Stress is worrying about one threat after another, after another. And we think if I don't worry, something bad will happen. Well, something's going to be late, someone's going to be mad at me. A lot of it comes down to judging. Another picture of the conveyor belt. So we're looking for moderation. We're looking for balance. We can't do everything. Like my nurse in the COVID unit, she thought that she tried to take a second job in a separate hospital as a nurse, and it was just way too much. So stress and negative affect versus acceptance and positive affect. Cup is half empty is more pessimistic, half full is optimistic. It's the same cup. Resentment is focusing on what's wrong. Gratitude is focusing on what's right. Which feels better? I think through meditation practice, sometimes therapy, we can learn to feel more of the positive feelings, to be more optimistic, less pessimistic, things like that. I think a big factor is toxic judging. And that's about judging if I'm okay or I'm not okay, normal or not normal, things like that. This is not useful, and it really gets in the way of self-care a lot, including that example of the nurse who felt that she didn't deserve to take care of herself. And so the toxic judging is really distracting. It interferes with decision making and causes more suffering. Most of our obsessing is unproductive, more wear and tear on our body. And when we're obsessing, if we focus on something else, we change the channel, a lot of times it kind of opens up new ways of thinking. So for example, if I'm really worried about something I'm obsessing, try to go for a swim, for example, and just clear my mind. And afterwards, it seems like new, fresh ideas come in afterwards. So a lot of the answer, I think, to stressing and anxiety and obsessing is the Serenity Prayer, and helping us to change what we can change and accept what we can't change, and to focus on what we have and be grateful. This is kind of an example of the toxic judging that goes on, and I think mindfulness practice can help to get rid of that. Now, we're going to start talking a little bit more about some of the neurotransmitters. And so, for example, anger and resentment, it feels justified. And when we get into that loop, it's addicting because it's raising dopamine levels. So justified anger is addicting. Okay, and if we understand that, then we can also learn how to break out of that pattern. Mindfulness practice just does so much for the self-care because it's kind of the director of the self-care. It's the wise mind in DBT that helps to direct what we need to do in the moment and to get rid of the judging. Daniel Spiegel and others have described 9 features of mindfulness. I just love to go over them because they're so concise and people can see how useful they are. And also, these are things that we want to teach parents because these are features of healthy parents. So for ourselves and for our clients, we want to be able to teach them about one thing. It's one thing to read about mindfulness or to hear about it. It's another thing to practice it. It's like the difference between reading about swimming versus actually getting in the pool and practicing and getting the water in your nose. So facing the stress, we want to separate what we can change, do what we can, focus on what we can change and take action, and then focusing on what we can't change is acceptance. And for a lot of people, that's the harder part, is accepting what we can't change. We want to be able to recognize the part that's about the judging. And also, part of practicing mindfulness over time is to be able to recognize when we start to go in this direction, when we start to worry or obsess or to judge, and to try to catch it as early as possible and redirecting our mind, because that's when the coping tools work the best. So, different neurotransmitters you probably heard about: serotonin is calming, norepinephrine stimulating, dopamine motivating, rewarding, GABA calming, oxytocin is about kind of a love hormone. And what you think can affect levels of these hormones. Okay, so kind of like guided imagery, for example. Just imagine a guided imagery, somebody spending time, visiting a beach in Hawaii, and how that would be changing their GABA levels. Or somebody doing a visualization of making cookies with their grandparents or grandmother, and how that would probably raise their oxytocin levels. So there's the brain neurotransmitters and the brain networks. The networks, there's a judging network. What are people going to think of me? That's the judging network. That's the one that really causes the toxic judging and most of our suffering. There's the executive network, which is the problem-solving network. And then there's the moment-to-moment tracking network, which is what's happening now. That's what we're trying to strengthen, that tracking network, by practicing mindfulness. So loving kindness meditations I highly recommend. For most of you are probably aware of that. And now the different spheres, areas, biological, psychological, social, spiritual. And these are areas to really start to organize our self-care routines: nutrition, exercise, sleep, medications, yoga, Tai Chi. So we want to have biological goals, and we want to be able to do like an inventory, okay, where you can say, what are my strengths and weaknesses here, nutritionally, exercise, sleep? Where are my strengths and weaknesses? So this is really about doing an inventory here. And am I working on these things? How am I doing, for example, with creativity, as an example? Do I have anything in my life where I'm working on creativity? Social, am I working on my social connections, my relationships, intimacy? Um, Hopefully, most of you guys know the difference between religion and spirituality. Religion is more of a structured form of a belief system. The traditions versus spirituality is more connected into a larger context of meaning. And so we can have spirituality without religion. We can also have religion without spirituality. And then there's worldview, which is a person's own interpretations of our basic questions. And again, to me, this all goes under that section of spirituality that we want to be able to work on. And different ways that we can tend to spirituality. My favorite is Nature Walk and my men's group. And the spheres are interrelated. So when you work on improving one area, it improves the other areas. I'm going to skip that. But I would like you guys to see this one, which is an inventory sheet that I have, and you're welcome to get copies of it. Biopsychosocial Spiritual Worksheet. And this is for everybody, for us, but also especially for our members, to do inventories, to kind of see where their strengths and weaknesses are, and then to focus down to one area and to work on that. Time is a major, major factor for all of us. And I think that to be well, to be resilient, we have to master our time. I'm also a Doctor Who fan, as you can see. And wellness is about choices, making choices our priorities. And I think about what does it take, and what does mindfulness do, and also what does Doctor Who do? And this is kind of what I got from the combination of Doctor Who and the mindfulness. Maybe call it Dr. Mindfulness. So those are the things I think that we want to be working on and cultivating, and managing our time and energy. We want to increase our definition of self-care time and of productive time, so that we can think about self-care as productive. I'm going to skip this, but basically, just briefly for you guys, I actually do something with my patients where we break down the number of hours per week. And we do the math here. There's 168 hours in a week, subtract 56 hours for sleeping, you have 112 hours left. You can look at, what else you have to do, driving back and forth to work, things like that. You come down to, after a lot of work, you come down to like 72 hours a week left, even after you subtract 40 hours a week for work. So that's a lot of time left, to think about self-care and how we're going to prioritize that. So this is an exercise in a worksheet. Also, this is something else I do with patients sometimes just to help them structure out the week. Quickly, in terms of boundaries, I like to look at the different types of boundaries. We use the word boundaries a lot, but I think if we break it down, there are time boundaries, priority boundaries, interpersonal boundaries, emotional boundaries, probably some other boundaries I haven't thought about. So if you guys can think of other type of boundaries I haven't listed here, toss those out. We want to be mindful of these boundaries moment to moment, and we also want to be clear with other people about these boundaries. And energy, I'm going to jump through energy a little bit, but we need to ration our energy, and we also want to look at things that will actually give us energy. Now, when we want to change behaviors, what we feel like doing has more to do with continuing the same as usual. A lot of behavior change means that we don't do what we feel like doing, or we do what we don't feel like doing. And this is my motto now. If you continue to do what you feel like doing, and to not do what you don't feel like doing, nothing will change. Now, there are certain activities that we may not have the energy for, but we know that if we do it, we feel more energy afterwards. So think about a couple of activities that you each have in your mind that actually energize you. So sometimes social interactions, exercise can actually give you more energy afterwards, spirituality, playing music, dancing. Think about some other activities that actually give you energy. Now, when we're motivated, I think this is also really important. I'm going to leave a few more minutes for QA. But dopamine levels, okay? We can affect our dopamine levels in our brain based on what you think. So if you're thinking about going for a walk or a workout, and you think about how much work it's going to be, I really don't want to do it. I'm going to look doing it. I'm going to look ridiculous. What are people going to think? It's going to make me tired. You're driving down your dopamine levels. You're making yourself less and less motivated. Or we can focus on how good it's going to feel to accomplish a goal, how good it'll feel after a few months, other positive consequences. I'll be healthier, I'll live longer, I'll be less of a burden to people. Maybe I'll need less medications. I can be a role model to others. What's that doing to your dopamine levels? Okay, that's going to bring them up and give you more motivation. And then we add additional motivators. So those are natural rewards we just talked about. These are logical rewards where we want to add some additional motivators. For example, a jacuzzi after exercising, or some tokens for every time you go accomplish your goal that you're building up for travel or clothing, and to set the goals really, really low so that it's like a no-brainer. Okay, I'm going to go, if I'm not exercising, I'm going to go on that elliptical cross trainer for 4 minutes, and then I get my reward, just to get you there. So we are close to the end here. And it's a good time for QA. Should we open up the microphones? Anybody having discussion? Here, stop presenting. Anybody have questions or comments? Yeah, if not, we'll give you some time to think.
That was really good. I definitely want more.
Thank you. Any particular areas that you'd like a little more information in?
Motivation to change my routine. Motivation. Different motivations to get out and exercise. To motivations to eat correctly. Eat nutritious foods instead of things that are just quick and handy. Grab something and actually prepare in advance things that will be healthy. Wait until I'm hungry to eat. Those kinds of things. Changing the behaviors are really difficult for me. As I get, I understand what you're saying. You get out and you take a walk and you have more energy, but dragging myself to do that when I'm tired is really difficult.
Well, welcome to the human race. Because I tell, I have a patient that comes to me and says, I'm lazy. I say to them, we are all lazy. Okay,
Mm.
human beings, animals, we are lazy. Okay, we would much rather sit, okay, than go out and do something active. Okay, so we have to treat ourselves like dogs. Kathy, you like dogs. You know how to treat dogs.
Yes.
I
Hmm.
tell my patients we need to treat ourselves and other people like a dog. Hopefully, you treat dogs compassionately.
Hmm.
Um, but we want to be able to. That's the way we train dogs. But how do we train dogs? It's the same way we want to train ourselves. So with dogs, we have to give them a little treat, right? We have to show them a treat and say, "Give me your paw," and then you get the treat. Okay, you have to earn it. And so we have to make ourselves earn our treats. And I think by if the first thing is if we can accept and acknowledge that we're basically lazy, so we have to trick ourselves. Okay,
Mm.
if we want to change our behavior, we have to trick ourselves. That's the only way I get myself to the pool is I trick myself. Okay, so I say I'm going to the jacuzzi, but I have to do 20 laps first. So you're looking towards the rewards. I'm not looking towards the activity. We're looking towards the rewards that are going to come. And so I think that having a basic understanding of dopamine is really useful because, if I give somebody Adderall, they'll be motivated to go for a walk. Okay, but it's still the same system. It's working, it's raising your dopamine levels. So we can raise our dopamine levels just by having motivational imagery in our mind. And what we focus on, I'm going to focus on how tired I'm going to be, and I focus on how good it's going to feel.
Okay, I think I'm going to post some of these slides all around my house, just so I have visualization to remember it. Thank you, Dr. Gilbert.
Thank you. Anybody else? Yes, I will send out a copy of that wellness worksheet to everybody. And let's see, we're almost kind of the end of our time. Anybody else have any questions or comments, and we can wrap up right about on time. Well, thank you all, and I hope this is helpful to us individually and also as an organization. Okay, nice to see you guys.
Thank you very much.
Stay well.
Bye-bye.
Bye.
Thank you.